Hello, everybody. My name is Dr. Sheila Dejbakhsh. Most people in the clinic know me as Dr. Dej. I am an OBGYN here with Hoag, and I work out of the Foothill Ranch office and also out of our Laguna Hills office as well. I am one of 20 physicians with Orange Coast Women's Medical Group, and we are a big OBGYN practice here with Hoag. Very excited to be part of Hoag. And we have many locations, Foothill Ranch, Tustin, Irvine, and also the Laguna Hills. So happy to see patients for any kind of OB or gynecologic issue. Myself, I am born and raised from Orange County, so I am a native here, and I went to school. I went to UCLA for undergrad, so go Bruins, that's my little support there, and did my medical school down in San Diego, and then hopped back to LA for some residency and finally landed in beautiful Orange County. So glad to be back and part of this wonderful group and part of Hoag. So we'll go ahead and get started today. Today we're all here to discuss fibroids. Okay, so first of all, uterine fibroids are benign tumors or lumps that are made of the muscle cell layer of the uterus. Now, the key there is that they're benign, so that they're not cancerous, and they end up forming these masses or lumps within the muscle layer of the uterus typically. They can vary in size, shape, and location. So sometimes they end up on the outside layer of the uterus. They can be within the muscle layer of the uterus, or even within the inside lining of the uterus. So they can be in various different places. They can also be of many different sizes. And they can either remain very small or they may grow over the course of months and years. And in fact, fibroids are quite common. So they are the most common pelvic tumor that women may have. It averages about 70 to 80% of women by the time they're 50 will have a fibroid. So it's more than you think, and oftentimes patients may not have symptoms and sometimes they do. So we'll kind of go into that as well. Okay. So now to review some risk factors associated with the development of fibroids. So first of all, race is a risk factor. So fibroids are found to be a little bit more prevalent in the African American population. About 80% of African Americans will have a fibroid by the time they're 50, and they tend to develop them at younger ages as compared to the rest of the population. Parity, or number of pregnancies. So pregnancy is found to be protective in the instance of fibroids. The more pregnancies, the lower risk of fibroids. Obesity, so increased BMI or body mass index can increase your risk for development of fibroids. There are some dietary modifications that can be associated with fibroids as well. So there's some literature to show that consumption of red meats may increase your risk for fibroids, whereas having a plant-based or diet full of leafy greens can decrease your risk for fibroids. Alcohol is a risk factor, and then genetics. So if you have a family history, other people in your family had fibroids, you have a genetic predisposition to having fibroids yourself. And then finally, age. So as women develop on through their reproductive years, and then start to get closer to menopause, we find that prevalence of fibroids does go up. So as you can see here in this depiction, we oftentimes will compare the size of a fibroid to a fruit just to have a little bit of an association or idea as to how big these fibroid tumors can grow to be. So they may be less than 1 centimeter in size, so very, very small, and those are usually the ones that don't cause any issues for patients. So they can be the size of seeds or cherries. They may be a little bit bigger, so medium size, size of a plum or size of an orange. This is usually when patients will start to notice some symptoms, and then there can also be large ones, so size of a grapefruit or even the size of a melon, so they can be quite large. Okay, so what are some of the most common symptoms of fibroids? One of the most common symptoms of a fibroid is abnormal menstrual bleeding. So fibroids may affect the period, they may increase the number of days of bleeding, they may increase the heaviness of the bleeding, and they may also cause you to bleed in between your period. So definitely can affect quality of life there. And sometimes fibroids can cause so much bleeding that women may be at risk for anemia or low blood count. And those are definitely the ones we need to address. The second most common symptom of a fibroid in the uterus is pelvic pressure and pain. So large fibroids may create this sense of pressure in the lower abdomen, and depending on where they're located may cause additional symptoms. So for fibroids that are on the front side of the uterus typically and are larger, they may put pressure on the bladder, and patients may start to notice increased frequency of needing to go to the bathroom, so increased frequency of urination. Sometimes fibroids can even end up causing issues with bowel movements. So if they're large, again, they may put some pressure and cause some constipation for patients. Okay. Other symptoms associated with fibroids include problems with fertility or pregnancy, low back pain, a mild enlargement of the lower abdomen, so feeling a little bit more enlarged in the abdomen, the frequent urination as we talked about, and then finally painful sex. So any of these signs or symptoms may come together and mean that there might be a fibroid present in the uterus. So how are fibroids diagnosed? The first most important sign of a fibroid, the first time we detect fibroids, is typically during a pelvic exam. So when you go in to see your gynecologist for your routine pelvic exam, or if there's a symptom that you're experiencing, that pelvic exam can help detect a fibroid in the uterus. And typically the next step is proceeding with a pelvic ultrasound. So there's a little example of a little ultrasound here on the right. Ultrasounds are excellent in the sense that there's minimal radiation to the patient, and they give us a lot of information as to where the fibroid is, how big the fibroid is. Its ability or sensitivity to pick up a fibroid on a uterus is very high. So it's a very good study that we like to start with, gives us lots of really great information, helps us learn about fibroids that patients may have. And the next possible treatment or study option is a saline infusion sonogram. So this is another ultrasound study where the uterus is filled up with saline or salt water, and an ultrasound is done at the same time, and this allows for us to see fibroids that have a particular proximity to the lining, the inside lining of the uterus, the endometrial lining. Finally, there's magnetic resonance imaging, or MRI, and hysteroscopy. So lots of great ways we can diagnose fibroids. Okay, so next up, is treatment necessary? So this is a great question. A majority of fibroids are small. They tend to be asymptomatic, meaning patients don't really notice that they have them, and they don't cause any significant problems within a patient's lifetime. So for those, if it's a fibroid that may be incidentally picked up on an ultrasound that was done for another reason, but don't cause any symptoms, usually patients will do just fine with them, no need for treatment. Now, if for some reason patients start to realize they have heavy or painful periods, if their periods are really disrupting their normal activities, if they're bleeding outside of their normal period time, or if they start to notice symptoms such as increased pelvic pressure, which can or may mean that there is increased growth in a fibroid, pelvic pain. These are all symptoms that may require treatment. Infertility is also a reason why we will treat fibroids sometimes. So oftentimes, if there's an issue with getting pregnant, a gynecologist may order an ultrasound to see if there's a fibroid in the uterus that may need to be removed in order to improve chances for fertility. So oftentimes women who are very young in their life, teenagers, adolescents, it's quite unlikely for them to have a fibroid. But as women age through those reproductive years and into menopause, the symptoms of the fibroid may start to pop up, and that is when treatment is necessary. So in terms of treatments, there are many different treatment options for fibroids. First, we'll review some medications that can help treat fibroids. And there's a couple different ones here to review. First of all, birth control pills or hormonal pills can help control the bleeding that can be caused by fibroids. They may normalize the period, and they may make it a lot easier for a woman to get through her cycle and day-to-day life in the way that it controls the fibroid from causing the abnormal bleeding. The next method is a progestin-releasing intrauterine device. So there's a little image here of a uterus on the right with a T-shaped device or an IUD. This T-shaped device is secreting progesterone, and there's something about the progesterone that really helps control the fibroids, make it so they don't cause as much bleeding, and sometimes decrease a little bit of the symptoms, bulk symptoms associated with the fibroid. So the IUD is always a good treatment option. And finally, there's the gonadotropin-releasing hormone agonist, which is another medication that can be used to help shrink fibroids, in fact. And sometimes that is used in adjunct with other options or other treatments. So there are lots of different medication management options available for treatment of uterine fibroids. Additional treatments include the option of a uterine artery embolization, or a UAE. So as you can see here in the picture, the purpose of the UAE is to inject these little tiny particles, they're about the size of a grain of sand, into the blood vessel that's feeding the uterus, and basically cutting off the blood supply to that fibroid so that it may start shrinking over a number of months. And this procedure is done typically by an interventional radiologist, but it's certainly something that can be an option for many women, and it's minimally invasive. And then there's the magnetic resonance imaging guided focused ultrasound surgery, which is also a procedure done by radiologists and interventional radiologists, where ultrasound waves are directed to the fibroid to destroy the fibroid cells, and the fibroid does start to shrink over the course of a couple of months. So these are both very novel and can certainly be options for some patients who are good candidates. Okay, now to review some of the surgical procedures. So one of the surgical techniques that can be used for fibroids is hysteroscopy. So a hysteroscopy is a procedure that is particularly good for those fibroids that have some proximity to the lining, the inside lining, or the endometrial lining of the uterus. So you can see in the picture depicted, they are pointing at a couple of fibroids that kind of impinge on or push on that inside lining. Those are actually the fibroids that tend to cause the most of the bleeding symptoms. So the procedure with hysteroscopy is an outpatient procedure where a camera is placed through the cervix into the uterus, and the fibroid is then removed that way. So you can see here, there's a couple of pictures, some intraoperative pictures, which is always fun and interesting. The before picture is what I would see if I were to go in with a hysteroscope which is a camera that I'm feeding through the cervical canal into the uterus. And that's a fibroid there on the inside lining of the uterus that we see. The during procedure, you can see in that picture there, the fibroid is being eaten away at by an instrument that we use to remove the fibroid. And finally, as you can see in the picture that's marked after, the fibroid is gone. So it's a pretty awesome procedure in the sense that it's an outpatient procedure, it's minimally invasive, patients do very well with this procedure, and it can be very effective for removing a fibroid. Finally, there are some other surgical options for fibroid treatment. The first one is a myomectomy. So myomectomy is a conservative surgical approach that keeps the uterus intact. So for patients who desire future pregnancy or are very interested in keeping their uterus, myomectomy is an excellent option. And this procedure can be done either as an open procedure, or it can be done as a minimally invasive procedure. So you can see here on the picture, that's the Da Vinci robot, which we have at Hoag, and has really allowed us to do pretty novel procedures with these fibroids. So we're able to remove large fibroids from the uterus through a procedure called a myomectomy using a minimally invasive approach with the robot. So robotic myomectomies are definitely possible. And finally, there is the option of a hysterectomy. So hysterectomy is the removal of the entire uterus, and a pregnancy is not possible after that, but the good news about the hysterectomy is that it is a definitive management option, meaning you will not ever have fibroids again. The fibroids cannot come back when you have a hysterectomy. So for many candidates, we can offer them a hysterectomy with a minimally invasive procedure using the robot. And the robot's awesome in the sense that it has really improved recovery for the patients, decreased pain and bleeding. So it's a novel technique. We're very excited that we're able to do minimally invasive surgery to treat fibroids. Okay, so now to discuss some questions. So let's see here, just going through some chat questions here. The first question is, do all women develop uterine fibroids? So that's a great question. We talked about this a little bit at the beginning. Fibroids are very common, and in fact, they're the most common tumor most common tumor for women, most common pelvic tumor. Ultimately, a majority of women will end up developing fibroids, but not all women. So about 70 to 80% of women will develop a fibroid by the time they're 50. So quite common. The next question here. I was just diagnosed with fibroids last year. I get some discomfort a few days before my period. Is that normal? So actually, that's a great question. That is actually very normal, common for fibroids. Having pain before your period can definitely hint at the sign of having a fibroid. And then, of course, pain during the period, heavy bleeding during the period, pain after the period. These are all signs that may mean that you have a fibroid in your uterus. So would require assessment by your gynecologist. And do fibroids, next question, do fibroids ever decrease? So unfortunately, fibroids, while you're in the reproductive years of your life, do not decrease in size. They will slowly grow. They're typically very slow growing. Now, when a woman reaches menopause and is no longer having periods, At that time, actually, fibroids do decrease. They shrink in size. So over the course of years, they'll slowly get smaller. Typically, if someone's menopausal and there's evidence of a small fibroid, they didn't have any symptoms of it during their reproductive years, we don't really worry about it much once they're menopausal, knowing that it will shrink in size. And the next question is, do fibroids ever turn into cancer? So fibroids don't turn into cancer, but some fibroids can be cancerous, though it's very, very rare. So the risk of having a cancerous fibroid is so rare, it's about 2 to 3 per 1,000 in some of the research studies that have been done. So extremely rare. They don't typically turn into cancer, but some of them may be cancerous. And if you're ever worried about that, that's certainly something to discuss with your gynecologist to kind of delve into it a little bit more. But by and large, they're benign tumors of the uterus. And then next question is, are there any supplements or surgeries that can help other than hysterectomy? So great question. We talk about this a lot with our patients. We try to make sure that we start with a conservative management approach in order to minimize any risk to the patient and talk through the different options. So there is medication management, which is typically first line if we can use that to control symptoms. And then outside of the medications, we have the options of the minimally invasive procedures with the interventional radiologist, which not all patients, but many patients are candidates for. And then finally, there are the surgical approaches that don't involve a hysterectomy. So the hysteroscopy is a great option for women who have fibroids within the lining layer of the uterus, the inside lining, and is a very straightforward outpatient procedure. And then finally, that myomectomy procedure that we talked about, which is a surgery meant just to go in and remove the fibroids, repair the uterus, and keep it intact. So lots of options there to maintain the uterus. And the next question is, how often should I get an ultrasound? Another great question. So with fibroids, we know that they grow slowly over the course of months and years, typically. So initially, getting an ultrasound to diagnose the fibroid is important. And then the next kind of time that we generally will get another ultrasound is if a patient comes back with symptoms that are worsening. So it's important to monitor your symptoms, see how you're feeling. If the symptoms are worsening, that may mean that you need another ultrasound to make sure it hasn't grown, or if it has, to then talk about treatment and figure out what the best treatment option is for you. And finally, is there anything that I can avoid to develop fibroids? Great question. Lots of research going into this, as there is in many things. But with fibroids, there is a bit of a genetic predisposition, so someone will get it regardless. Now, there are some behavioral modifications that we can practice. First of all, healthy diet and exercise. It's very overarching and can help in many other fields, but can definitely help in minimizing your risk for developing fibroids. So maintaining a healthy weight and a healthy diet. Some research studies have correlated the consumption of red meat to the development of fibroids, so minimize the red meat intake. And some studies have correlated the intake of alcohol with development of fibroids, so minimizing intake of alcohol as well. And that's kind of it. Those are the big ones. So,
I have more questions.
Sure.
Yeah. If you can just repeat them.
Yeah.
Can you share more about the causes of fibroids?
The what, sorry?
The causes of fibroids. Can you share more of the causes?
The causes.
Yes.
Got it. Okay. So causes of fibroid. Gosh, I wish I could share more. Fibroids are, smooth muscle cell tumors that grow within the uterus. They're benign. If in terms of what causes a fibroid, very hard to tell you. I think there's a lot of research going into that as well. It is really just a replication of cells uterine cells that ends up kind of replicating over and over and forming a ball of cells to form a little benign tumor within the uterus. So unfortunately, the pathophysiology and all that is really being looked into, especially because fibroids are so common in the population for women, but the exact cause is not quite known.
Okay, for fibroids greater than 8 to 12 centimeters, is hysterectomy or partial hysterectomy the best option?
That's a great question. 8 to 12 centimeters is a good size fibroid. Now, it really depends on where the fibroid's sitting. So the location of the fibroid can have a very big impact on which surgical approach might be best. The issue with getting just a fibroid removal versus a hysterectomy is that there is a risk that the fibroids do reoccur. So there is a risk of reoccurrence if you just go in and take the fibroid out. But certainly it does become a conversation between the patient and her doctor about whether or not hysterectomy is the best option or a myomectomy is a good option. So hysterectomy is not the only option, but certainly does warrant a discussion. And it really depends also on where the woman is in her life cycle. So if she's within her reproductive years, is really desiring to get pregnant, there might be a push to do just a fibroid removal or that partial procedure. Now, if a woman is not within her reproductive years, is very symptomatic from this fibroid, then there might be some thought into going forward with a hysterectomy.
What are the chances of a fibroid coming back after a myomectomy?
Great question. As we kind of talked about here, fibroids do reoccur, and they, not for everyone, but they can reoccur. So for women who undergo the myomectomy procedure, literature has shown that over the course of about 2 years that the women have been followed, about 30% will develop new fibroids. So there is a risk of reoccurrence, and it does tend to be about 30% for women. Now, if someone is later in life and may be entering the stages of menopause soon, that risk might be lower, but that's just kind of a general overarching.
What are the downsides of partial uterus hysterectomy?
So the partial uterus hysterectomy, if I understand correctly, is what we call a supracervical hysterectomy, meaning that we keep the cervix intact, but we remove the uterus and the fallopian tubes typically. The downside of that is not too much. You would have to continue to go for pap smears. So if you get your uterus and cervix removed, you kind of get to opt out of those pap smears. We still like to see you in the office regardless, but really it's just a matter of monitoring for cervical cancer because that cervix is still in there, but the bulk of the uterus and uterine muscle is gone. So should not have any more symptoms of fibroids.
What typically happens to a fibroid after childbirth?
Great question. So after childbirth, sometimes fibroids can shrink in size. The thought process there is that it may increase in size a little bit during pregnancy, so we do sometimes notice a shrinkage once the baby's born. Other than that, it tends to kind of follow the normal life cycle, where over the course of years, it may slowly grow or maybe stable for a couple years and then start to grow. Yeah.
That would be it.
Great. Awesome. Well, thank you for joining me tonight. I know it's a very important night out there, so just wanted to send out my thanks. And if you have any questions, feel free. We're always happy to see you in the office here at Hoag. Thanks.